Yes, I am.
Okay, well, we appreciate all that have joined us on this call today. My name is Janine Taylor. I'm with District Health Department number 10. I'm the Public Information Officer. And I am joined by Dr. Jennifer Morse. She is the Medical Director for District Health Department number 10, as well as Central Michigan District Health Department and Mid-Michigan District Health Department. I think several of you on the call have already been on some calls with Dr. Morse, but she will be facilitating this call today and answering most of the questions that all of you may have. But before we get started, again, we just ask that you mute your phone. I can mute everybody as well, but I think it would be best if you just all mute your phones, and then Dr. Morse is going to give a small presentation, and then we'll open it up for question and answer. You can also ask questions in the chat box. So feel free, if you do have questions that you'd like to ask, feel free to begin in the chat box. So with that, I'm going to hand it over to Dr. Morse.
All right. Thanks for joining us. We thought this was the most efficient way to do it. So as Janine said, we have 3 health departments worth of educators and superintendents joining us today. So that's 18 counties worth. So hopefully then everyone's questions will help everyone out. If it gets to be too much, we can always split up the districts, but we thought this would be the most efficient way to take care of things. I'm going to go through some slides to just go over whatever updates have happened since the last time we talked, and I'm going to go through just a little bit of discussion about the COVID activity in counties right now and where we feel things stand at this time. So I'm going to hopefully go through that pretty quickly so we can devote most of our time to questions and answers. So just to let you know, we just found out today that the state finally did put on the website where you can see the phases that we are in. Previously, there was a map that showed risk levels, and the My Safe School roadmap really refers to what phases you are in, which is the economic recovery status. So this website is on here. We'll post these slides on our school section of our coronavirus web pages for your respective health departments. And I'll later on show you where those sites can be found. But if you go to the michigan.gov/coronavirus webpage, on the top, there's a tab that says the tab that says My Safe Start. If you click that, there's one that says public guidance, and it takes you right to this page. It looks just like this. So just so you know, that has finally been posted. So again, talking about phases and risk levels, there really has not been an official declaration from our state saying if this happens, then you should close your schools. The CDC is saying that if there is substantial uncontrolled transmission, then the schools should think about closing for in-person education and in-person activities. If you're looking at the My Start map info, which I'm going to go over here in a second, that is really similar to the risk levels 1 and 2. But again, just today, we got some additional information from some other sources. They give us a little more clarity to that, and we're still asking for more guidance on that so we can give you better advice. So if you go to the mystartmap.info, this is an old map. I took this from the first presentation we used. Everybody now is kind of the darker yellow, except for Region 6, which is the lighter yellow. So we've all kind of improved in our status. This is where you can really find the risk levels. So what is the activity in your area? So I'm actually going to work through this here for you. I first wanted to share, this was a resource that was just shared with us today from the state. It's called Reopening America's School Public Health Approach. And it's from a group called Resolve Save Lives. It's a nonpartisan nonprofit group. It's actually run by a former head of the CDC. They put out some really good information, but this is a nice, short, easy to read discussion that really reviews a lot of the data about, the facts that kids tend to not catch COVID as easily, spread COVID as easily, get as sick as much with COVID. A lot of the data about what happens in schools with COVID. So it's something that you may to share with your teachers and educators and encourage them to look at. It talks about the reasons why it is really important to have in-person school, but then also, what we need to look at in terms of when does the risk outweigh the benefits of having in-person education. One thing they talk about, I just put one quote in here from them, talking about with COVID, closing schools probably doesn't have as much importance with COVID as it does for things like influenza or other respiratory illnesses, because kids just don't seem to be as big of a factor for spreading this disease. Another thing they address in their question and answer section, they have a very long question and answer section, is that when there is substantial community spread, schools should probably suspend in-person classes for a while. And really, there really hasn't been a great definition for what that is, but what their opinion is that when 5% of people being tested are positive, and that's consistently rising, or when 10% of people being tested are positive, and whether it's going up or down, it doesn't matter, that's when you really should think about closing. And there have been many states that have looked at doing it that way. And so that's one thing to consider. Basically, though, if you go through your county and you look at it, you are all well below, at or below 3% positivity rates. Many of you are less than 1%. Some counties were quite higher earlier on, and most of it was because of very specific outbreaks. Some are a bit higher, but the cases have been related perhaps to nursing home situations. And so if you look at Michigan as a whole and compare to all your counties, you are all doing better than the state as a whole. So at this time, I do not see any reason to have concerns about starting in-person school for any of our counties. I went through all of them before this talk. If there are concerns, some options could be to, let me just start this up again. Options can be to stop higher risk activities such as athletics. Another option would be to do primary school in person only, since older children or adolescents are more prone to spread illness in the way that adults do.
Dr. Morse, do you want to share your screen and show so you can show the PowerPoint?
Oh, I must have. I'm sorry. I can't talk and do it at the same time. Okay. Here we go. I'm just kind of bummed I didn't get to walk you through all that. Okay. So again, if we use that 5% positivity as a major marker, I don't see any concerns at this point. Again, I know that doesn't always comfort people, but the risks will be there whether people are at school or if they're out of school, because if they're out of school, they'll be doing other activities. One thing to keep in mind is Labor Day weekend. We all know that people will be doing social activities over Labor Day weekend, so we will likely see an increase in cases 1 to 3 weeks after Labor Day. And I think we really just need to remember that that doesn't necessarily mean that we're having this big resurgence, that schools causing outbreaks, things like that. So we're going to have to work on our messaging. I'm going to talk with a state group this evening to see if they have any messaging planned around that to try to prevent some of that issue. But that's one thing I'm concerned about, is that the association of Labor Day and the start of school might have some people blaming the wrong thing for those increases. So for the sake of time, I'm going to move on. So some updates that have occurred since our last talk. There was an FAQ that came out in relation to the executive order that addresses your requirements. So the FAQ had in there, are face shields acceptable alternatives to masks? The answer was no. Who determines, what's that? Who determines whether, oh, somebody must not be on mute. Who determines whether or not a student or staff member can medically tolerate a face covering? The answer to that was that schools should require documentation from a medical professional as they do for other types of accommodations. In our toolkit, which we provided, and I'll go over in a minute, we did provide a form that you could use for healthcare providers. I also sent out a letter to all of our primary care providers in our region, explaining to them that this is a requirement that they are going to be asked to help with, and asking them to help you with this, and I provided them with resources to help them help you. And the last one was who should not wear facial coverings, and the state defined that simply as kids under 2, those with trouble breathing, anyone unconscious, incapacitated, or otherwise unable to remove their face covering without help. So other updates, again, we did provide a form that you could use. The toolkits, really you could go to any of these websites, but specifically for those counties in Central Michigan, the website is cmdhd.org/novel schools is where all of our school materials are at. And it's just called School Toolkit. DHD10.org/coronavirus. There's a section called Guidance for Schools about way down the page. mmdhd.org/novel-coronavirus under a section called Schools/colleges/universities. You should have been sent a copy of that toolkit. Again, if you were not, that is where you can find it. And if we have any updates to it, that's where they'll be. That provides you with a lot of guidance and information, as well as tools to help with student screening by parents, staff screening, this form, and other things. Another update that we had more solidified, and some of the groups I talked to already, and then some of the ones I didn't, it depended on when we got this update, whether or not this was part of the previous talk I had with you. But the Executive Order 147 that requires masking whenever you're in a public place, schools do not, the term enclosed public space does not apply to schools as it is written in this order. So follow the My Safe School roadmap when it comes to masking. So in terms of quarantine, when I first started talking with schools, I said that we'd probably have to quarantine an entire classroom with consideration and discussion with other medical directors and things like that. We've really decided, because of the limited transmission between students, we're really trying to limit close contacts to just those that were closest to classmates. So hopefully we don't have to quarantine an entire classroom. And that is discussed fully in the toolkit that I just talked about on pages 5 and 6. For screening of students, initially we weren't quite sure how that would work, and we were afraid, we were all afraid that if someone had the sniffles, they'd be out of school for 10 days. On July 23rd, the CDC did finally provide quite a bit of good guidance for all of us. And one thing, they officially state in bold print that they do not, as we do not, recommend that schools do the screenings themselves, that they recommend parents monitor the students for signs of illness. And the symptoms being used for illness is a shorter list and emphasizes that the symptoms be new, so that hopefully unnecessary absences will be minimized. And the determination of when a student can come back to school and how they can come back to school is based on their risks for COVID. So there are algorithms and flowcharts and tools in the toolkit for you, but basically if they have a fever, if they have a sore throat, if they have a new uncontrolled cough that makes them short of breath, if they have diarrhea, vomiting, or abdominal pain, or if they have a new severe headache, those kids should stay home. Mainly they're sick, so they need to stay home no matter what. If they have a risk for COVID, so that risk is defined as within the last 14 days, they've been in close contact with somebody with COVID, they've been in contact with someone in quarantine because they've been exposed to someone with COVID, if they had international travel or been on a cruise, or if they're in an area that has higher levels of COVID. So if your area is in the risk level 1 through 3, which right now nobody is, those kids would be considered at higher risk for COVID. Certainly you can be more aggressive with it. You know, if your school, if your community is seeing higher rates of COVID, you could consider really any student with these symptoms being higher risk and have them go down the COVID branch of the algorithm. That's on page 7 in your toolkit, and it looks like this. Basically, if they have symptoms, they need to stay home. If they have any of those risk factors, they need to go down this branch and they need to see a healthcare provider or get tested, whichever, either and or one. If they are diagnosed with COVID, or if they didn't get tested and there's no other diagnosis available, they need to stay home for the full isolation period. I mentioned this later on, but that's another thing that's changed since the last slide deck was made. Now it's still 10 days from first symptom, but it's now only 24 hours without a fever rather than 3 days without a fever. If they do get tested and it's negative, if their risk factor was that they had close contact to someone with COVID, they need to finish out their 14-day quarantine. So they shouldn't really have been in school anyways, but that's just there as a reminder. If their test was negative, they haven't been exposed to COVID, then they can come back to school once they meet criteria for whatever their symptom was. So if it was a fever, they have to be fever-free for 24 hours. If they had a sore throat or a cough, they need to feel better. If they have strep, they have to have had 2 doses of antibiotics. All of these things are explained in the Managing Communicable Diseases guide that is given to the schools from MDHHS. If they didn't have any of those risk factors, so they're not felt to be at high risk for COVID, then they can return when they get better per those guidelines. So this is in that toolkit for you. This covers staff. The guidelines here, I think I go over that. Yep, I'll go over that in a slide or two here. So again, with students, this just talks through that flow chart. And again, just a reminder here that it has changed from 72 hours to 24 hours without a fever. And that changed on July 20th. So as soon as you put something in writing, the CDC will change it. It's guaranteed. So for staff, we set the staff screening up to align with the My Symptoms app screening, and MDHHS was appreciative to have these line up so that if you did happen to change between, you know, paper screening and the app, it's all going to line up. And this is nice too, because they have to have, if they have one of the major symptoms, a fever, cough, or shortness of breath, or 2 of the minor symptoms, then that would necessitate them to not be at work and to consider further evaluation rather than one of any of the symptoms, because, you know, sometimes it's just a headache or something and then they'd be out for 10 days. So if they have a fever, a cough, or shortness of breath, or 2 of the following, the aches or pains, chills, sore throat, headache, vomiting or diarrhea, or loss of taste or smell, then they should be out for 10 days. The recommendation is for them to be out for 10 days regardless of test results, because adults are more contagious and tests can be falsely negative. There is some debate about that, you know, if they're negative, should they come back? And that can be determined on a case-by-case basis. You know, if someone had headache and diarrhea, and it's really unlikely that they have COVID and those things improve after 5 days, you know, you could consider case by case and you could consult with us about that. But again, there's just always that chance for false negatives. So I just put this up here. I know some of our school districts cross health department boundaries. So I just put up here a reminder of where our health departments fall, which counties are in which health department, how to find our contact information. Even though my primary email ends with CMDHD, I do cover all of these counties. So if all else fails, just email me and I'll figure out who you need to talk with. So again, just as a reminder for which health department covers which counties. I'll leave this up here for a minute, but at this point, I will open it up for questions.
All right, Dr. Morris, we do have several questions that are in the chat box. So we'll start with the first one here. Well, the first is a statement by Jeff Mount. He says, this is the information we need to get to our news sources. Our experts need to share accurate information so our families can make their decisions to send their children back to school on facts rather than fears as presented by the news outlets. So again, Jeff is asking that we share this information with news outlets and get it out there.
So I'll talk with my health officers and see what the consensus is on that, but I agree. And I know there's a lot of unknowns too. I mean, we don't know what's going to happen, but we also know what not being in school can mean for some kids too. So I'll talk with them and we'll see if we can't do some kind of community education.
Mm-hmm. Okay, next question from Jessica Heron.
Thanks, bye.
Okay, how can we find the form regarding a person who cannot medically tolerate a face covering? Is that Appendix E that we're talking about?
Yes, so it's a toolkit that should have been sent to the contact we have for the schools, and it's also on our website. It's Appendix E in the toolkit.
Okay. Next question, Brett Zuber. Any chance that your department could put in writing that there are no concerns for our areas for opening face-to-face? We will make sure all of our families and community are made aware of this. It would be extremely helpful for all districts.
And if I said no concerns, there's never no concerns ever. At this point though, I would say the risks, the benefits of in-person school outweighs the risks. But like I said, I'll talk with my health officers and see how we might be able to publicly communicate that.
Okay. Next question, Rich Saladin. So should schools not do temp screenings upon entry?
It is not recommended, simply because then you have more close contact with your students. It's extremely time consuming and takes away time from educating children. And so that is the recommendation of the CDC. Like I said, it's right on their website there. You certainly can if you desire, but it's not required. And again, they actually don't recommend that you do health screenings, including the temperature.
So they're putting it more on the parent to do that prior to sending their kid to school, correct?
Right, to ensure that they are not ill. They don't necessarily have to check their temperature. They just have to ensure that they aren't feverish or have symptoms of illness.
Okay. Next question from Jason Kennedy. This morning, Spectrum Health Ludington Hospital provided an update that suggested the positivity rate in Ludington was 4 to 5%. Maybe I misunderstood, but I'm wondering if this is something that can be confirmed.
I'm pulling up Ludington on my map right now.
Hey,
Is that-
Dr. Morse, this is Sarah. I can actually answer that. I was also in that call, and she was referencing the tests that were done by Spectrum Health only.
Okay, yeah, because Mason County is 0.8% positivity. So less than 1% positive, and they're doing 2,500 tests per day, which is right at the state average. So it's not like they're under testing. So again, that's the hospital themselves. So they're only testing sick people, you know, so it's a little bit of a biased, but the county as a whole is 0.8% positive per the state. Well, that website, My Start Map, is actually run by the University of Michigan. Yeah, I think the state helps them with it, but it's not just the state, it's also the University of Michigan that helps with that. So their overall incidence for the entire county is just 0.8% at this time.
Okay. Next question from Jeff Mount. For those districts that have wraparound services, licensing is saying we will have to do the health screenings with temp checks. Will that change with the updated CDC guidance?
I don't know what wraparound services mean. I don't know how that's different. So if you have a regulation that's different than what the roadmap and the health department and CDC say, I'm not aware of it. So whoever's giving that regulation, you'd have to follow up with them.
Yeah, that's Lara, Licensing and Regulatory Affairs for child care services.
Okay, yeah, the CDC was specifically speaking of schools. So if Lara is giving you a requirement, then you need to follow what Lara is saying, I guess. Yep.
Thank you.
Yep.
Okay, next question from Chad Zian. Sorry if I'm butchering your last names. It says the MHSAA is recommending students' temperature be taken prior to competition. This contradicts CDC. Recommendations, HIPAA violation? Those are questions. What are your recommendations, and is it a HIPAA violation?
So with regular school, you're able to distance and all that. So again, the CDC is talking about regular school. With athletics, we've already seen some cases occurring from training and practices and things from athletics. Athletics is a much higher risk situation. So you need to take added precautions. So if they have those recommendations, again, those are outside of the everyday going to school with masks on, social distancing, things like that. So that's a different situation.
Do you want to address HIPAA violation,
yes,
Dr. Morse, with regard
so
to schools?
Schools are not covered by HIPAA. HIPAA only covers covered entities, which are healthcare providers and insurance companies for the most part. Schools do not have to follow HIPAA. They follow FERPA. So that's, again, that's something don't know all the ins and outs of because it doesn't apply to me, but HIPAA only applies to covered entities.
Okay. Next question. Schools need the health department to get this out in the media. So another suggestion for that. And we will definitely work on a communication plan for pushing into the media and doing some education.
I think just
next question.
Part of the messaging will have to also be that people are going to get COVID. Students and teachers will get COVID. But in reality, again, if they didn't go to school, teachers and students would have gotten COVID as well, you know, and it's hard to know if there would have been more or less. And so it will be difficult when we have in-person school. If people get COVID, it's going to be a challenge. You know, it'll be, oh, it's because we went to school, everyone's getting sick. Again, if they didn't go to school, we know that kids would be playing together, hanging out together, not wearing a mask, not social distancing because they're not in school or someone's forcing them to do that. So that would be part of a message, would be people will still get COVID if we go to school. It's not going to be COVID free. And so we'll have to expect that. But again, if they weren't in school, they would still, a certain percentage of those people would still get COVID somehow. So.
Okay. So next question, are you discouraging us from doing temperature screenings as students enter the building using kiosk towers by the entry of school buildings?
I'm just saying you don't have to. You can certainly do whatever you feel comfortable with. You just need to know that if you are doing that, you need to make sure the machine works, that it's calibrated. You do whatever quality controls you need to do to make sure that it is working. That if somebody does have an elevated temperature, you have a plan for what to do, those types of things. So just simply stating you don't have to. And data right now shows that about 50% of kids with COVID have a fever. And a large percentage of them are asymptomatic, so have no symptoms. So just a reminder that it's not going to catch all the COVID.
Good point. So next question, should schools be doing temperature checks, or you're saying parents should handle that? Again, tying into that.
I think we covered that.
Yeah. Okay. Can we, next question, can we have a copy of this PowerPoint emailed to us?
I don't have a problem with
email
that.
it, and it just, yeah, and it is, we do have a link to it on our website, on each of our health department websites as well. So. Okay, next question. I have teachers asking about in-classroom activities. They want to know if they should eliminate group work, games, and meeting on the rug. My thought was to have pods within pods.
So you want to keep distancing as much as possible. So most of those activities, as I envision them, would encourage students to get close together, and so that should be discouraged. There have been, and I've seen different postings, and I know teachers are really good at searching out what other people are doing and making up good ideas, but there has been a lot of creativity put into finding new activities that don't encourage getting close together. But I would discourage anything that brings children closer together in distance.
Okay. So the next statement, it says, at Dr. Morse, we would take that message as well, from S. Locke. I'm assuming that means they would push out the same message, whatever message that we are putting together for the media. I don't know if that's what you mean, S. Locke.
And hopefully the
Okay.
next 4 weeks don't cause any, I think too, my gosh, 4 weeks is a long time if people have 4 weeks until their start date. So I don't want to jinx myself, but I'm hoping that things continue to trend down like they are right now. So but yes, we'll work on that for sure, because I know you guys are fighting against a lot of fear and misinformation.
Okay. We've got a phone that needs muting. The next question, can we use hand sanitizer with aloe?
As long as it has 60% or more alcohol and no one's allergic to aloe, go for it.
Okay. Hang on 1 second here. Okay, next question from Penny Dora. Are you able to verify that the reopening plan on your website is the same plan as the MSPRA is sharing? I believe this is true, but would like confirmation.
I think the MSPR is a communication plan. Is that correct? Which is a different plan. MSPRA.
MSPRA.
Yep. Yeah, that is a communication plan, which is very good and is a good partner to the toolkit that we've provided. The toolkit that we've provided has been shared statewide, but that is more addressing the public health type issues. So how to screen for illness, what to do if someone is sick, how to clear someone to come back, how to help the health department with contact tracing, things like that. So they are two different things.
Dr. Morse, this is Penny. They sent out one that was from MDDHS.
Okay.
It was the state plan for what you're talking about, but it had a different front on it than yours.
Is it purple?
Yes, it is.
Yeah, we made it blue because we like blue better. So
okay.
Same thing. Yep.
I wanted to make sure that those were indeed the same plans, because yours came out a couple days ahead of that one, and they seem similar, but there's a little bit different looks to them, and I just wanted to verify they were indeed the same.
Yeah, they are.
Thank you very much.
Yeah, no problem. But they do still have a really good communication plan too, so.
Okay, next question from Sandra Russell. Where would we find out what types of cleaning products are approved for student use in classrooms? We have looked at the EPA site and can't find this specific information.
So I know there's been a lot of controversy about whether students themselves can use cleaners. And that one I will have you talk with your legal counsel about. The American Academy of Pediatrics recommends, I believe it's hydrogen peroxide, citric acid, or alcohol-based cleaners. That was in my first talk that I gave. Let me double check on that here really quick. But those are the ones that they base because or recommend because they're less toxic. Here we go. When possible, use products labeled as safe for humans in the environment, containing active ingredients such as hydrogen peroxide, ethanol, which is alcohol, and citric acid, because they are less toxic, not as strong of a respiratory irritant or asthma trigger, and are not cancer causing or cause other detrimental effects. So that's what the American Academy of Pediatrics recommends in terms of the safest ingredients to use around children. Again, we've heard a lot of questions and controversies as to whether or not children can actually use the cleaning products, and I'm not going to answer that question because it seems to be a liability question, so I defer that to your legal counsel.
Okay, Abby Watkins, she's the emergency manager for Newaygo County, mentions to please keep in mind that the Michigan START map data reports 2 days behind.
Yep, and we're
So
usually
data,
looking at like a trend. So if there's 1 or 2 high days, that wouldn't necessarily make us close the school. So we need to look at a trend. So the recommendation again was 5% and rising, or 10% positivity rate, regardless of the trend. So again, 1 or 2 bad days wouldn't necessarily make a difference.
Next question, Mary Mormon. We are seeing an increase in enrollment right now, virtual programs, and many families are having issues with immunizations and health screens. Is there guidance or flexibility coming on that? And she says, sorry, it's only semi-related to COVID.
So I guess I'm not quite clear on the question. Does that mean, do you need to do health screens if you're virtually learning, and do you need to have immunizations? If that's the question, you know, if you're registered in a public or private school in Michigan, you have to have your immunizations or have a waiver. If you're not going to the school, if you're only at home, you know, there's no required proof you're doing a health screening anyways. But if you're staying home, you know, you don't need to screen to go to school because your school is in your home. But if the question was something different, please let us know.
I'm going to hop on the mic here super quick. Sorry, I should have specified with the kindergarten health screens that they should have coming in. Lots of kindergartners coming to the program who are just having trouble getting into, you know, see a physician right now.
Okay. I honestly don't know that one. I know that they've made some exceptions for things like sports physicals because of that issue. So that would be something you'd want to check with the Department of Education to see if there's been any exceptions. I personally don't know that answer. That's just not something in our realm. The vaccines, the health department can help parents with vaccinations if their providers are not able to get them in. But the health screening, I don't know if maybe there's been any kind of an exception put on that because of provider issues.
Thank you.
Okay, next question from Ken Haggart. Any recommendations for large groups of students who arrive at school prior to the start of the school day and find themselves grouped together waiting for the actual day to begin?
Oh, that's a good question. And I know that happens for quite a few students because parents' schedules and things, and especially if we're recommending so many now, you know, discouraging bus use and private transportation instead. I don't know. You know, I don't know if there's a way you might think about, because I know at least at my kids' school, they won't open the doors until a certain time. So I don't know if you might want to think about having supervised outdoor time where someone is intentionally helping them to spatially distance, because then it's safer outside. Or if you want to have someone in charge of supervising them indoors and keeping them distanced indoors. But that is a good question. I hadn't even thought about that. But it might be one of those situations that you just might need to have an adult supervising it, which I know is an added cost to the schools, but I can't answer that very well for you. That might be something to go to the Michigan Board of Education, because I can't quite answer that for you.
Okay. Next question from Julie Hunt Barnard. Please don't assume that kids and teachers will be participating in activities that will expose them as much as being in school if they are not in school.
No, I'm not assuming that. I'm just not assuming that they're going to stay home 24/7 either. So I just don't want people to think that not having in-person school is going to make them completely free of all COVID risk. So it's, you know, you kind of have to think about all the different situations.
Okay, next question, Kevin Griffin. Do symptoms of high school students aged 13 to 18 more closely resemble those of adults or children, elementary age students?
Most young adults and teens have very mild symptoms. And so I would say symptom-wise, they're more, this is a tricky one. What we're seeing with young adults and children is just really, really mild illness, like tickly throat, tickly nose. It easily is missed. In terms of contagiousness, they're finding that kids in their teens, and one of the more recent studies found that kids over 10 tend to be more like adults in that they're a bit more contagious and a bit more likely to catch COVID. So hopefully that answers that question.
Okay. So the next question was, could you put the link to the PowerPoint in the chat box? And I only have the link to your last PowerPoint, not this one that you worked off of today. So as soon as we get your copy of today's PowerPoint, we'll put that on our website. But I can put a link, which I will do right now. This is on our DHD10 website. That is the PowerPoint of Dr. Morse's last presentation. Which
is out of date. You know, we just went over today a lot of those updates. So it will be at for DHD10, it'll be at the DHD10.org/coronavirus and then under the guidance for schools, correct?
Yep.
Yeah.
Okay, so we'll be sure to get the updated PowerPoint on our website. We'll also, yeah, I mean, I think that's the best way to have access to it is to go to the website and click on it from there. Emailing it, we can certainly do that as well, but sometimes firewalls block attachments, so it might cause an issue, but we can certainly try to do that as well. Okay, next question, Jerry Ward says, page 5 of the Return to School Toolkit states, a contagious teacher walking around the room to lecture could expose the entire classroom if following the PPE guidelines. Would they not have to be in close contact for 15 minutes for the entire class to be quarantined?
So those were some examples of what could cause a contact. So it goes on to explain more about that. So it's not just 6 feet and 15 minutes. It's also duration and length of exposure and things. So if let's say it were elementary and you had a teacher with, I think it should have said without PPE. But if there were a teacher who were teaching a class for 6 hours a day for 5 days while they were contagious, that amount of exposure, if they were walking around the room, that is a huge exposure to all of those students. So it's something, it was more of an illustration of we have to really take the whole situation into consideration. So if the teacher is trying to keep at distance and is able to stay far away from all the students at all times, we may be able to perhaps just quarantine the front row if they always stay in the front of the class. But we know with elementary students, it might be a bit different. So it's really going to have to be a case-by-case basis rather than just blanket quarantine. Some other states have just, if one person's sick, the whole class is out, and we're really trying to avoid that. But there may be situations where that may have to happen, but we'll try our hardest not to do that.
Okay, next question. This is Scott Acom. I'm having a difficult time finding anything school related on DHD10's website. I must be looking in the wrong area. Could you share where you can find it? And I just posted a link to the coronavirus page in the chat box. And if you scroll to the middle of the page, there's a light blue box that says guidance to reopen, and you'll see school guidance is right there at the top of the list on the right side. So hopefully that will help you find what you're looking for.
You have to scroll down a bit. So Just keep looking.
Yep. There's a lot of information on that page. So
Yes.
next question, Len is asking for recommendations on recess.
That is well detailed. One spot is the Harvard guide that was referenced in the first talk that I gave. Oh gosh. And I'm drawing a blank on the majority of it, but it's essentially the same as in school. Try to avoid shared objects such as like balls and toys as much as possible, or have students check them out so that they can be checked back in and wiped down. Try to avoid really close exposure or contact. Try to have kids play together in their pods or small groups. Those types of things. You do not need to clean playground equipment in any special way. Just those personal use type objects like balls or toys. But again, I know there's more detailed information in the guide from Harvard that was referenced in the first talk that I gave.
And we can, Dr. Morse, if you want to send a link to that guide, I can put that on the website as well.
Yeah, I can do it right now.
Okay. While you're doing that, next question says, from Jason Kennedy, have instance where a student had been with an out-of-state parent in a divorce situation this summer. The parent here in our district is seeking advice as to when their children can return home to Ludington because their parent out of state is COVID-19 positive. Any advice?
So if they are currently with someone who is COVID positive, they should be in quarantine currently, and they should be in quarantine until it has been 14 days since their last exposure to that individual. So once they've finished their quarantine, they can return to Ludington. The other less favorable option would be for them to come back and finish their quarantine in Ludington. However, if they do become ill, then everyone in that household now will have to be in quarantine. And the health department in the state that they're in now should hopefully have explained all that to them, but I know sometimes education doesn't cross state lines and family lines sometimes, but it would be 14 days from their last exposure. So hopefully they're able to keep separated from the ill family member. Usually they can segregate into different rooms. If they're not able to do that, they have to wait till the mom or the dad are no longer contagious and then start the 14 days. So it could be up to 24 days or more. So if he has questions, he could always call our health department there in Mason County, and we could provide some information. There's also a spot on the CDC website that talks about quarantine.
Okay. Next question, Steve Johnson. Where on your website is the PowerPoint from today? And that will be placed there today. By the end of the day, it'll be there. So we'll make sure that it gets posted. And again, it would be on that dhd.org/coronavirus page. And that would, you just have to scroll to kind of the middle of the page. You'll see a light blue box that says guidance to reopen. Next question, is there any benefit to having air purifiers, especially in smaller spaces like offices where a speech teacher may meet with students?
Yes, actually HEPA grade filters have been shown to be helpful. There's quite a bit of information about that in that Harvard guide, and I put the link to that in the chat section, and it's also in that original PowerPoint. But they have quite a bit of information about ventilation, your HVAC system, HEPA filters. You just want to make sure you get one that is large enough for the room. And, you know, obviously maintenance it properly, change the filters like you're supposed to, that kind of thing.
Okay.
I mean, he'll start his day out there, but
We've got a,
it sounded like you were more, yeah.
and 1 second.
I watched your. Oh, okay. I remembered it as I was talking about that way.
Hang on 1 second, bear with me. Just me.
Maybe I mean, I work from home, but I'm having a hard time getting anything done. Like me coming here and interrupting you.
No, I'm over it. I'm done.
Yeah, I'm so tired of these meetings.
Yeah.
Okay. Next question. Just FYI, this is from Donalyn. We have received legal advice that MCL 380.1504, which is compulsory physical examination or medical treatment not authorized, prohibits us from doing the temperatures on all students. The legal recommendation for public schools is to have parents do it prior to sending their children. So thank you for sharing that.
And then I also, from the Montcalm ISD, they shared a image from FAQ from the Michigan Association of State Superintendents that said they could do it if they got authorization from the health department, which, you know, we've never heard of anything like that either. So again, to me, that's just all the more reason to not worry about it. But it's just very interesting, different rules and things. But if anyone does want to do it and they feel like they have to have authorization from us, you can get in touch with us. But it is very interesting, the different rules.
Okay, next question, Phil Morse. I haven't heard anything about the immunity testing for COVID since June. Any updates on that?
Not really. It still has a pretty poor, because the amount of infection in the community is still relatively low. So it has a less than desirable positive predictive rate, meaning if you're positive, we can't be sure it's from COVID and not some other coronavirus. We don't know if it really proves you're immune or not, how long you'll be immune. So we don't use it for diagnosis. It's mainly a big use of it right now is the CDC is doing a lot of studying just to get an idea of how much of the community has actually likely been infected. And it's about 10 to 12 times the numbers that we know are infected is what it looks like. But there's not any utility to testing your staff, to getting tested, you know, to prove that you've had infection or to prove that you're immune at this time. So they're still working on it.
Okay. John is asking, Dr. Morse, would you be willing to have a session for staff in our counties?
So I was asked by one county to put together a 15-20-minute recording covering just a variety of topics. And I'm trying to get to that. It's been challenging to get to that, but I'm trying to get to that. And then my plan was to share that with whoever wants it to use for their staff. And it, you know, it is challenging to get personally with 19 counties worth of schools. I've been trying as hard as I can to accommodate any request. But if that is something, so again, once I get that done, hopefully I'll get that done soon. We will offer to share that with whoever wants it, to share it at faculty trainings or, you know, that week before school starts when you start having meetings. So hopefully that will fulfill that request. If not, we can try to make some other accommodation. But again, I just warn that I likely won't have time to help everybody out like that.
Okay. Mackenzie Curry says, I've clicked on the Return to School Toolkit on DHD10 website and it says the file is damaged. I just went and clicked on it and it downloaded for me. I put a link just now at the bottom in the chat box. So I'm not sure what the issue is there, but we will be sure to go in and check if there is an issue. Okay, you were able to open it, no problem, Dr. Morris, I see. So you're still sharing your screen. I didn't know if you knew that, but you're okay, but we'll make sure that that gets fixed, and I did put a link to it below in the chat box. And let me see, next one, just a comment again from Abby in Nuevo County. She says, FYI, Governor Whitmer just signed Executive Order 2020-164 requiring masks at child care centers and camps. Executive Order 2020-164 requires all staff and children ages 2 and up to wear a face covering on a school bus or other transportation. Additionally, all staff and children ages 4 and up must wear a mask covering in all indoor common spaces. All staff and all children 12 and older are required to wear a face covering when in classrooms, homes, cabins, or similar indoor small group settings. The governor also strongly encourages that all children ages 2 and up wear face coverings when indoors. These rules align with the existing rules on face coverings that already apply to pre-K to through 12 schools across Michigan. And there is a link there.
Good to know.
Yep. So that is it for the chat questions. Do you want to open it up now to anybody else that's on the call that may have an additional question? You can unmute yourself and ask.
Dr. Morse, I did have a question about the shields versus the masks. And I had a DHD 10 staff member say that to our food service director that shields could be used in lieu of face masks in the cafeteria. But it's my understanding that shields only are insufficient. Am I correct on that?
A face shield does not equal a face covering. So on the FAQ, and that's been consistent from a public health standpoint, but now the FAQ that I referred to from the state specifically says a facial covering is a cloth material that covers the nose and mouth. Facial coverings may be secured to the head or simply wrapped around the lower face. They can be made of a variety of materials, et cetera, et cetera. So, and then it says, are face shields acceptable alternatives? No. So no, if someone is required to wear a face covering, a face shield is not an alternative.
Okay. I just wanted it to be known that came straight from a staff member, that it was okay. It's right in an email to my food service director. So I just,
was that in Mecosta County?
Misaki.
Okay. Was it a food service person who said?
It was from, I'm not sure what their title is, but
that's okay.
They were right from the health department number 10.
Yeah, I was made aware of some communication about a week after it happened of someone telling someone that a face shield was okay. I didn't realize it applied to the schools though. So I will make sure that it did get passed on. So thank you for letting me know.
Thank you.
Jennifer?
Yeah.
Doctor? Hey, Ken Haggard from Fremont Public Schools. Question for you regarding, I asked this morning to Kevin, but I'll ask you. We have a number of parents who brought in exemptions for wearing masks in school, and we suspect there may be more coming. And so we are wondering what our options are. One of the things that we've talked about was insisting that, okay, you do not have to wear a mask, but what about now you have to wear a face shield. And we know where face shields are, but Kevin's response this morning was, well, face shields are better than nothing, but we're not sure how you would feel about, okay, they brought in the exemption for a face mask. What does a face shield look like? Your thoughts?
Right. I think a face shield is definitely better than nothing. And there are a few brands that actually have kind of a cloth around the sides even. The form that we provided actually has the two reasons that the physician is given to mark are the two that the state gives: difficulty breathing, or they can't remove their own mask. And then below it, it says, if they can't wear a face covering, can they tolerate a face shield, yes or no? So that would be one thing you could do, is you could advise the parent that your child has to wear a face shield, and if they say they can't, then you could require them to get another exemption from the provider to say they can't wear a face shield. I mean, that would be an idea. But it does block some of the droplets that come from their mouth. It just doesn't block it as well as a face covering. So it's definitely better than nothing. And I can't think of, other than maybe some neurologic issue where they just can't tolerate the feeling of it, I can't think of any reason why somebody couldn't wear a face shield.
Okay, thank you.
Yep.
There was a question about, there's a link to the clear mask in the PowerPoint. Is this an approved option? And Steve Hall said, Rich, yes, they are approved. The clear mask. So the next question real quick is the mask exempt form on your website? And the form is on the website. It's in the toolkit, and it is Appendix E in the toolkit. So you would find it there. The Return to School toolkit is what it's called. Okay, any other questions? Dr. Morse, I know that you had a list of FAQs that you worked on providing answers to. Is there any in there that you wanted to cover that you didn't with the presentation?
No, those were questions that had been posed during our first session of talks. Okay. Those have been all put together, and I reviewed them recently and updated them with all these new updates. And I believe all of the health departments have put them on their websites with all the other school information.
DHD 10 has not yet. I was just waiting for your final approval. And once I get that from you, because there were some adjustments made today, I will get that FAQ up on our website.
It'll be there soon. So I see a question just popped up. Is it correct that a student who tests positive for COVID can return 10 days? So I know it does seem odd. Okay, so let me get through this whole question. Student who said the virus. Okay, so a person who's tested positive, no symptoms at all, they can come back 10 days after the test. And if they have symptoms, they can come back when it's been at least 10 days from the onset of their symptoms, and they've had 24 hours with no fever and their symptoms are improved. They do not need a negative test. They've done tons of research which has shown that people really are no longer shedding any viable virus past 8 or 9 days. If you test them again, they will be positive for up to 3 months at least, in many cases, because they still are shedding cells from their nose and throat that have viral RNA still in it. So they'll still be positive, but that virus, there's no live virus there. So we really discourage you from trying to test them to try to get a negative test, because you're not going to get a negative test. people who've been exposed need to be quarantined for 14 days, which seems weird. Like these guys need to come back in 10 days. These guys have to wait 14 days. That's because it can take up to 14 days after exposure to show signs of illness to become infected or ill. So we have to wait that full time to make sure they're not infected before we let them come back. It does seem very odd, but that's just how the virus works. Unfortunately, that is the fact of it. Let me see the rest of this. If they don't have to have a negative test. The one exception to the 10 days, if someone is really sick, so we're talking ICU and or intubated, they may need 20 days before they can come back. So those are situations we take case by case, or if they're immunocompromised. So if someone who's on chemo or has who has AIDS, not just HIV, but AIDS, they may shed virus for a lot longer. So those people may need to stay home longer. Then there's another one, I think. So Jacqueline from Central posted a link in the chat box with the frequently asked questions that Central Michigan has up. So, but we'll keep adding things to our website as we get them finalized. And since I was sharing my screen forever, you saw that I was putting together an email with my slides so that those will get posted later today or tomorrow to the website. So any other questions? We're going to do
Keep
this.
it in mind.
Oh, go ahead,
I
Janine.
was just going to say that, Dr. Morse. Go ahead.
I was just going to say, we're going to do this again next Thursday at 1, and we're willing to keep doing it every Thursday at 1 for as long as you need us to. We can always change the time, but we figured this was probably the most convenient way to try to help answer everyone's questions. If you have any other suggestions or different thoughts to how to do this better, let us know. But this was my thought, was to just briefly go over any updates or changes and then leave it for question and answers. So again, feel free to email us if you have different thoughts, but otherwise we'll talk to you next Thursday.
Thanks, everyone. This recording will also be available on our website.
Thank you.
Thanks, Dr. Morse.
Good luck.